All right, good morning and welcome. We're so glad that you can join us today to have what we believe is a really important discussion about how the COVID-19 pandemic is increasing or is impacting some of the most vulnerable communities here in Utah and beyond. So I'm really glad that you can join us for this conversation. My name is Elizabeth Kronk-Warner, and I have what I believe is the best job in the world because I get to be the dean at the S.J. Quinney College of Law. And I'm really pleased to be joined by three amazing women who are going to talk to you today about how this pandemic is impacting various communities. And I do believe that this is an incredibly important conversation because although certainly the pandemic has negatively impacted many elements of our communities, we've seen a disproportionate impact on some of those most vulnerable communities. And the way that those communities are being negatively impacted has certainly varied throughout the state. So again, I very much appreciate their willingness to take some time to chat with us. So our format here today is we're going to start off with approximately a 10-minute presentation from Nubia Pena, who is the director of the Utah Division of Multicultural Affairs, and I'm also very honored that she is a graduate of the S.J. Quinney College of Law. Then we're going to hear from Professor Erica George, who is the Samuel D. Thurman Professor of Law at the S.J. Quinney College of Law, and she also serves as the director of the Obert C. and Grace A. Tanner Humanities Center. Then after she is done presenting for approximately 10 minutes, she's going to turn it over to Council Delegate Eugenia Charles Newton, who is a council delegate with the 24th Navajo Nation Council. She represents Shiprock, New Mexico, and she also serves as chairwoman for the Law and Order Committee, and she is also chairwoman for Public Safety and Justice at the Tribal Interior Budget Council. So she will be talking about how the pandemic is impacting the Navajo Nation. But before I turn it over to Director Pena, I did want to say Eugenia Charles Newton is going to talk specifically about the Navajo Nation, but I do want to make everybody aware of an effort that a member of our community, Heather Tanna, has been undertaking for all tribes in Utah. So if you have any interest, she's working with the Utah Department of Human Services, the Indian Law Section of the Utah State Bar, and the Utah Division of Indian Affairs, among others, to address the needs of all 8 tribes within Utah. They have an item donation drive that ends today, but if it's not possible for you to make an item donation, you can also still make a monetary donation, and you can find more information on their efforts at the Indian Law Section Bar website, which is Indian Law, all one word, .utahbar.org, and you can also just Google it if you Google the Indian Law Section Drive. So I did want to mention that there are also efforts to assist all 8 tribes, and we're going to focus our discussion today on what's happening at the Navajo Nation. So with that brief introduction, I'm going to turn it over to Nubia Pena, who's going to give us what I know is going to be a fantastic overview to the great work that she and those that she works with have been doing in Utah and how this crisis has really been impacting some of the vulnerable populations in Utah. Nubia?
Excellent. Thank you so very much, Dean Kronk-Warner, and thank you all to the S.J. Quinney College of Law, my second family, and the Tanner Humanities Center for inviting our division to partner on this critical conversation about the impacts of COVID-19 and our underrepresented communities. I also want to acknowledge and thank our first responders and frontline advocates that are showing up daily, knowing that they have risks, but showing up nonetheless so that they can help our communities. Now, as a brief introduction to the Utah Division of Multicultural Affairs, our mission is to promote an inclusive climate for Utah's multicultural communities. And our vision is to be a model state by ensuring equitable resources and services to all who call Utah home. I was recently appointed in 2019 as director, and I feel very privileged to serve in this capacity with an exceptional team that I deeply value. As many of you know, on March 6th of this year, Governor Herbert declared a state of emergency in Utah due to the pandemic. Now, we recognized very quickly that in the face of such an unprecedented situation, there would be many social, cultural, and economic dimensions to this crisis. We sought to establish a baseline of immediate needs and unique barriers that were faced by disenfranchised populations during the outbreak to better inform our state leaders of the growing gaps and to really try to solve these concerns together. Now, with the support of our Multicultural Commission, which is co-chaired by Lieutenant Governor Spencer Cox and Byron Russell, and the Martin Luther King Jr. Human Rights Commission, chaired by Ms. Emma Houston, our division prepared a survey for service providers and first responders working directly with vulnerable and systematically marginalized communities. If we can please go to the next slide. The qualitative data collected highlighted that the lived experience of our underserved constituents, and it also allowed us to understand the complex and intersectional crises that many people were enduring. But it is critical to note that these were pre-existing needs that our communities were already experiencing long before the pandemic hit. So however, it's important to also note that the severity of this crisis has magnified, amplified. Oh, excellent. Thank you so much for putting those up. So the severity of the crisis has magnified, amplified, and really compounded the inequities to create greater lack and devastating outcomes. So I won't dive into this too much because I know that Professor George will go into this with greater detail, but I hope that this is something we can continue to flesh out. So the data that was coded was based on keywords, phrases, and ideas that emerged from each question. And these codes allowed us to cluster the data based on commonalities and significant topics. In 1 week, my team and I were able to create the local needs among multicultural communities during the COVID-19 pandemic report, which you can download on our website at multicultural.utah.gov. The overarching themes that emerged and guided our report and the recommendations include physiological and safety needs, language and literacy accessibility, a coordinated dissemination of information, culturally mindful and inclusive approaches, and also the need to include diverse representation and perspectives in all decision-making practices. And finally, to address systemic inequities. If we can go to the next slide, please. Thank you. So the unique barriers were outlined in each one of these sections. And what we found were the barriers faced by marginalized communities in light of this outbreak. For example, was 75% noted that access to computers and technology was a huge barrier. Not having access to these resources created a gap for many to be informed and important updates and directives, being able to access them that were quickly changing or to be able to stay connected due to social distancing restrictions. This has also widened the digital divide and impacted the way that our youth now access their education, causing many to fall behind. There are reports that are coming out that show that our children, those from most often underserved and underrepresented communities, haven't accessed their education in the last 5 weeks. 74% of participants also noted that food insecurity was a significant concern as households navigated the social panic and buying that was occurring very early on and continues to now happen. Limited interventions and increased demands at food pantries and unaffordable food options. So unlike some Utahns, stockpiling food items before and in the midst of the pandemic really presents financial challenges for communities with restricted resources as they purchase only what they can on a limited basis. 67% of respondents also noted misinformation as a significant barrier faced by those that they serve. Lack of accurate information can fuel greater inaccuracies and cause additional fear within communities. So our participants shared that this occurred around questions regarding immigration enforcement. What happens, can they be deported? What happens with the public charge rule? Can they access medical services? And how seriously do they need to treat the executive orders regarding social distancing and stay-at-home restrictions when also that wasn't being considered around cultural appropriate messages, right? This is something that for our communities, they convene in large families. They live in multi-generational households. How does social distancing guidelines take into consideration 7 to 8 people living under one roof? Housing insecurity. That was another one that was noted, but also continues to be on the rise in terms of the concerns. There are also fears around staying home if the home is not a safe place due to domestic violence and sexual abuse, which is now increasing widely across our state. According to a report released in Utah County, there was 75% increase of their phone calls regarding domestic abuse. Access to healthcare services. This was also noted that those without health insurance or a full knowledge of available resources, there was a lot of uncertainty when it came to testing and treatment. So we now know that testing might be free, but there were a lot of issues and fears around, do you need an ID? What happens if you need treatment outside of being confirmed positive or negative for the COVID-19 exam? Language barriers. This one was huge. Currently limited English proficient and non-English speaking populations are navigating revolving news and resources through predominantly English only mediums. And the lack of access to translated information from reliable sources is a prominent fear. In addition, the delay of language accessibility information was causing terror and misinformation to increase. So for our undocumented and mixed status family, the fear of deportation or repercussions to immigrant status was also noted as a concern. Individuals who are undocumented fear getting tested and also receiving the treatment for COVID-19 because of negative legal repercussions. Landlord-tenant concerns were also noted as a significant issue. Individuals who are experiencing housing insecurity are facing landlords who may not be fully aware of the state responses, such as the moratorium on residential evictions. There were also fears around predatory practices increasing that would exploit the situation and drive people out of their homes without the opportunity to access housing or shelters. Now, for the sake of time, I want to be really mindful that we have two other people that will be presenting on similar issues, but I really do invite others to read the report in full. This report, I think, just begins an opportunity for many of us to understand that not all Utahns have been equally affected by this crisis, and that we now have an opportunity to implement equitable, inclusive, and justice-oriented efforts to reduce the growing inequities borne disproportionately by historically underserved communities. Now, our hope is that we use the growing data, not only from this report, but from the Health Department, from the Kempsey Gardner Policy Institute, and anyone else that is using evidence-based data to show that the gaps are growing, for us to respond with the urgency to close that gap. We also believe that our state can move forward creating model practices, particularly during times of emergencies, that are culturally inclusive and considerate of people who call Utah home. Because it really will take all of us to ensure that none of us are forgotten. And we look forward to being able to support each one of our partners, our state leaders, in advancing efforts that promote inclusion, equity, and human rights so that we emerge stronger from this crisis together. If we can go to the next slide where my team is shown. Before wrapping up and passing the time over, I do just want to thank my exceptional team at the Division of Multicultural Affairs. I rely on them so much to be able to do some of the efforts that we think and we are asking for guidance as it relates to better serving our constituents. And I also want to thank every partner that has stepped up to support the work and address the gaps, but because I know that there were many people that are stepping up right now to say, how do we help? How do we close that gap? How do we address the disparities? How do we get the information to our communities that is language accessible, that is literacy accessible, that is consumable and digestible? Because we know with trauma and crisis, the brain processes information differently. So how is it accessible to every person that is calling Utah again their home? Lastly, I just want to say thank you, Dean Kronk-Warner, for providing this space to us as we move forward with the conversation so that other people can join in and say, how do I help? And we can give them very clear and actionable next steps to get involved. Thank you.
Great. Okay. Wonderful. Thank you very much. I think I am unmuted. My name is Professor Erica George, and I am going to pick up where Nubia left off to really emphasize the issues of inclusion and put Utah in a broader context. Utah's challenges are far from unique, and we have a real opportunity to lead with inclusion. So I wanted to talk first about the legacy of inequality, the social determinants of health, and then solutions and why sustained efforts will be necessary. So I'll limit my remarks to 3 parts to keep things simple, though this is a complex problem. The racial disparity data. One of the challenges is not having sufficient data. There have been calls for more race-conscious reporting, And based on the data that we do have, as of the beginning of April, very few states were collecting, sharing, releasing, and reporting data. What the data has shown is what we feared, a deep racial disparity with more people infected and dying in populations that are descended from people experience a current level of discrimination or a past historical one. So really, this looks back to where we've come from, and that is health inequities and disparities. From the 28 states that have released racial demographics, it is confirmed that the coronavirus is higher in terms of death rates if we look to the racial demographics of groups that are traditionally underserved. The data is being tracked through the American University's Anti-Racist Research Policy Center, and what they found is there's less information about testing, there's less testing, there's higher infections, more hospitalization rates, and still this information remains incomplete. But it is enough to signal that we have a very serious problem, which Director Pena and her team are working on. Just by way of comparison, in New York City, we know that 34% of the deaths have been in the Latinx community when they're only 29% of the population. We know that 17% of the deaths have been African American when they're only 9% of the population. We know that in the 14 states where Blacks make up only a third of the population, they're disproportionately represented in those experiencing hospitalizations. In Chicago, my hometown, 70% of the COVID death rates, 70% are Black. In Milwaukee, numbers are similarly startling, and in Louisiana, 70% of the deaths have been in the Black population when they're only 32% of that state. New Orleans, deeply affected at 60% of the deaths. In New Mexico, our next speaker will speak to the challenges there, but last count had newer, higher infection rates there at levels higher than any other US county. So minorities are being tested the least, yet dying the most. And insights into why this could be occurring are rooted in our social determinants of health. The World Health Organization and UN agencies, as well as the CDC, recognize that health is a holistic right, and it's enjoyed based on the social determinants that you are able to access. We know that there's speculation that poverty accounts for the disparity, but that's not the full story. I would suggest that the underlying conditions call for us to question why the conditions are as they are. Why is it that there are comorbidities existing in vulnerable populations, such as hypertension, asthma, cardiovascular disease, diabetes? If we recognize that those exist in these populations, then our next question would be, why is that? And that cannot be simply put down to choices, but rather the constraints on choices that people are limited by. Director Pena has spoken to some of them. One of the big paradoxes of this pandemic has been who's an essential worker and the extent to which essential workers are being treated as expendable. So concentrated in these kinds of work employment situations are people from traditionally disadvantaged groups and people of color. So people of color are more likely to lose their jobs, yet the jobs they're doing are the ones that require being at work. Not everyone has the luxury of working from home, and the rates of the ability to do that are also skewed with our racial demographics. Interestingly enough, the Pew Research Center, to the point of choice and how those are constrained, it was actually found that people of color were more likely to be worried and concerned about the coronavirus and their health. Almost 46% of Blacks, more than twice the white population in the United States, thought that they were at higher risk for COVID-19. Latinos, 39% to 21% of the white population believing that this was a real risk for them. And those fears have been borne out. So I think what's very startling is even with the understanding that you are more likely to be at higher risk in some people of color populations, they are still dying at higher rates. And that's deeply disturbing. So I'd like to highlight the point that people of color are not to blame for dying or being disproportionately impacted by disease. And if we accept that to be the case, then there is more that we can be doing to lead with inclusion. Just to put this in a broader scale, the United States is also not unique. Looking at numbers out of the UK, Black Britons are also dying and being affected at higher rates. Pakistanis are 2.7% higher death rate than white Britons. So what's universal is this disparity. It is not unique. It is not unique to Utah, which it makes it all the more important that we find ways to lead and address it. For some of the racial data tells us things that we didn't know. For others, the racial data tells us what we've long suspected and have known. And now moving to next steps, finding ways to address these paradoxes will be imperative. The Tanner Humanities Center will be continuing a series of conversations on COVID beyond issues of inclusion, but also impact, many of those mentioned before by Director Pena, including digital divide, access, and connectivity. And again, the low-wage workers, particularly those who are migrant and in the shadow and undocumented, ICE has not let up in other parts of the countries on enforcement. And there is documented evidence that people who are undocumented do feel at risk and are not presenting to be tested and certainly are not receiving treatment. Why does this matter? Why should you care if you're not a part of a person of color community? The thing with pandemic disease is it's infectious and it infects us all. We are only going to do as well as the one of us who is doing the worst. So we can do better. There is room for improvement. It's imperative to understand how racism works, whether that's conscious bias or direct bias. We know that people have been presenting people of color to healthcare providers, and speaking outside the context of Utah, where cases have been documented of people being turned away repeatedly for not meeting criteria to receive testing. As those criteria shift and change, thinking about what would be an inclusive way of capturing and caring for vulnerable populations will be essential. And right now we do need to do better. Leading with inclusion would be teaching about social determinants of health to our upcoming healthcare providers and medical schools currently, and thinking about how we're teaching our new leaders, whether that's in law, whether that's in the community more generally, which is the work of the Utah Division of Multicultural Affairs. I will leave it there because I know we have time for Q&A, and I'd like to turn it over to our next speaker.
Thank you. Can you all hear me? Hello?
Yes, yes, we can hear you.
Great, great. Thank you. Thank you, Ms. Cronk, Dean Cronk, for allowing me to sit on this panel. As previously stated, I am a member of the 24th Navajo Nation Council. I was sworn into office in January of 2019, so we just finished our first year in office. There are currently 5 committees that fall under the Navajo Nation Council. The first is Nabikietskit, which consists of the Council of the Whole, which requires 24 council delegates to be present during that time. Health, Education, Human Services is another one. They have 6 delegates. Budget and Finance has 6 delegates. Resources and Development has 6 delegates, and Law and Order Committee has 5 delegates. As stated again, I am the chairwoman for Law and Order Committee, so that is a big undertaking on my part. I live in Shiprock, New Mexico, which is one of the three largest communities on the Navajo Nation. Shiprock is considered to be a large community, but I do have to state that we don't have the best internet connection, which is why I have to call in and not Zoom in. If I use 2 services at one time, it's very glitchy and makes it difficult to communicate. So for that reason, I do apologize that I don't have PowerPoints with my talk, but I'm hoping that even then it'll still be an inviting presentation. So I kind of want to give you some facts of the Navajo Nation. Currently, the Navajo Nation does span 27,000 square miles. It does fall within 3 states. A large portion of that is within Arizona. The next biggest portion is in New Mexico, and then there's also a small portion that's also there in Utah. So we do have a large area. A big percentage of the Navajo Nation does not have paved roads. We do have paved roads, but a lot of the communities still remain without paved roads. And I'm going to speak clearly as to what I know in regards to percentage, because one of the big issues that we run into in Indian country is the issue or the fact that data is not really collected on Indian country across the board. There's generalized data that's provided, but usually each tribe is required to provide their, or to assist in making sure that the data that they do have is somewhat consistent, but it's very difficult to do because we lack the infrastructure to keep data. So I do apologize for not giving you exact data as to what I'm talking about. The timeline of this virus, on March 7th, the coronavirus hit the reservation. Navajo officials did trace this surge to an evangelical church rally in Chieftain-Bitwell in Arizona. At that point, on the Office of the President and Vice President, along with council, we did jump into action. We were well aware of the coronavirus, and Navajo Nation Council did have a briefing on this virus during its winter session in January. So in January, we did, Navajo Nation Council did start sending out information on the coronavirus and ways to protect from getting this virus. Unfortunately, I think that somewhere in the midst of everyday life, it really may have been overlooked. But on March 7th, when it did hit the reservation, I think at that point everybody was aware that this virus was something that couldn't be reckoned with. So on March 11th, 2020, the Navajo Nation approved a resolution that declared a public health state of emergency for the Navajo Nation due to the confirmation of the coronavirus being on the Navajo Nation. At that time, they also introduced the name of this virus, and in Navajo, they call it the Kosinskago, which means the big cough. And so that name became synonymous with the coronavirus, and that was the way that the Navajo people were made aware that this virus was out there. On March 20th, 2020, the Public Health Emergency Order number 2020-03 was issued by the Commission on Emergency Management, which I refer to as the Curfew Law. This curfew law was implemented, and the penalties for the curfew were that individuals could be fined $1,000 and or serve 30 days in jail as a violation of the curfew. The curfew was a 57-hour curfew. It starts Friday at 8 o'clock p.m. and it ends on Monday at 5 o'clock a.m. So this was actually a new thing for Navajo people because having a curfew was something that it has always been in the Navajo Nation code, but it was never really implemented on the people entirely. So this was a step in trying to contain the virus, the Kosinskago. On March 29th, 2020, 2020-03, which was the emergency order that established a curfew, was extended, and it continues to last this long. So to be clear, the first weekend of the curfew was in April. It was the first weekend in April. But the community of Shiprock was glad to be part of the curfew. But I believe that each community had we looked at it as this curfew as a means of preventing the virus from coming into our community, because at that time there was not any reported infected people in our community. We distinguished the term prevention versus containment. Containment, we thought, or we tried to push, was for those communities where they did have a positive case reported in their community, versus prevention where the communities had not been infected yet. So we did move along and we did take part in the curfew. A lot of the Navajo people were happy to do that as a means to try to protect not only ourselves, but our family. Today, as of yesterday, there were 3,632 positive cases that were confirmed. The information that we got this morning from the Health Command Center did provide us that information. But as of today, I don't know exactly how many Navajo people have died from this virus. I believe that the last count that I received was 104. There was some confusion, and there still remains confusion as to the data. As I stated previously, it's very difficult for us to keep that data because we don't have the infrastructure in place at this time to help assist in keeping all that information. So right now, the information or what I've been hearing on the news, what we have been hearing from reports being given to council is the numbers continue to increase because Navajos have a high number of people who have diabetes. And so that is one of the underlying conditions of the coronavirus infecting the body, and then also in some cases leading to death. So diabetes is on the reservation. It has been for quite some time, and there has been a push to try to eradicate this diabetes. But in the midst of this, we did get hit with the coronavirus. There's also talk about no running water. I know that it has been reported again to council that 40% of the people who live on the reservation have no running water. And to be clear, some of the communities have no running water, and they are pushing to try to get this water to the communities, but it has been very difficult. The other reason why numbers have increased is multiple families living in one home. There are multiple generations who live together, and so when one person gets infected, it's very hard for them not to infect other people. So people keep asking, why don't we have build homes, particularly for people who are COVID-19. Establishing home on the Navajo Nation is very difficult. There's so many red tapes that are involved that are currently in place that make it difficult to even use our land. These hurdles are sometimes created by our tribe, and we are currently working to try to address that. But there's also some that are created by the federal government as well. And we are, again, currently working with the federal government to see what we can do. And for Dean Cronk students who have taken Indian law are well aware of what some of these hurdles are. Today, in regards to the curfew, there continues to be a 57-hour curfew that remains in effect. In fact, this weekend will be the first weekend that curfew will require all businesses, even those that are considered to be essential. The curfew will require them to be closed this weekend. In the past, what was happening was we were having people who were during the curfew, but we have one grocery store in our community, and that grocery store was open during a limited time, but people were actually going to that grocery store, standing in line, and violating the curfew. But because food is considered to be essential, it was very difficult to say that they were violating the law. Right now, we have $600 million from the CARES Act. There were guidelines that were shared with tribes on how this money can be expanded. Navajo Nation has received $600 million. I believe we are the only tribe that has received that amount of money. These guidelines, again, are impediments that make it difficult to use the money because we can't really use the money to build infrastructure to address like broadband services, because some of these projects have to have had been, ongoing since March 20th to March 1st, 2020. So we're still trying to get clarification on what these guidelines provided are, how we can try to stay within the guidelines. The other thing is people in the Navajo Nation are pushing to try to provide water to each home on the Navajo Nation. We did have a meeting this morning with Bureau of Indian Affairs, who controls our right-of-ways for the Navajo Nation, to see if we could try to speed up the process, because a right-of-way could take about 6 months to 2 years to complete the whole paperwork and the process. Even then, once it's completed by BIA, it then gets turned over to the Navajo Nation. So there is a process in that. We're also looking to try to address dead zones to allow for teleconferencing. Living in the city, it is easier to be able to access the internet, but as I stated earlier, living here on the Navajo Nation, some of us don't have internet, and if we do, it's very shoddy internet. So with that, that is my presentation, and I do want to conclude by saying that this pandemic has certainly changed the way that the Navajo people live. And it's brought attention to the issues we face in Indian country. It's brought worldwide attention. And I was just reading a few days ago, and I did try to look for that article, but I believe that we are actually, our numbers compared to New York City is actually higher than New York City. Based on how many people we have living here on the Navajo Nation. So this virus is really taking over the way that we live, who we are as a people, and it has taken a lot of our people to date. So we look forward to the day when we can remove our masks and when we can, no longer have to do social distancing, but more importantly, we look forward to the day when we can greet people once again with a handshake. So with that, I do stand for questions. I hope that is the information that this panel was looking for. And again, I do apologize that there is no data provided to my presentation. As stated, data right now is very difficult to obtain. We are working to try to do this, but because we don't have the proper infrastructure in place, it makes it difficult for us to track that data and to really keep on top of those numbers. Thank you.
Great. Thank you all for amazing presentations. So we have about 15 minutes now or so for questions. If you look at the bottom of your page, you should see a button that says Q&A. You can type in your questions into the Q&A box, and then I can go ahead and moderate those questions. And while we wait for the audience to submit their questions, I think probably a lot of people are wanting to know what they can do to help. So do any of our panelists have any thoughts on things that anybody, whether they're lawyers or other members of our community, might be able to do to help the various communities that you all have chatted about today?
Erica, do you want to go first?
No, go ahead. Go ahead.
Oh, excellent. Thank you. So for those that are lawyers and are interested in supporting, I think right now what we are going to see is an influx of individuals with questions regarding eviction concerns and what happens, if they are facing losing their home. What are some of their rights as landlord tenants? What do they have in terms of the support in the community? So whether that's Utah Legal Services, the self-help, or even some pro bono, like where can they access this? Is it language accessible? Another thing that we want for people to be mindful of is donation, right? I'm so grateful that I spoke recently with Jeanette Bott at the Utah Food Bank. They are doing really well because it's the generosity of our community that recognized there was going to be an influx of families that needed this service. And so they have been donating, continue to do so. If you have an opportunity to, right now we have a small diverse business leader that stepped up and said, we want to partner with the Veteran Affairs Office and the National Guard that are doing the frontline translation. And again, I just need to say thank you to them because they have been exceptional in working with Zeman Zhao, who is the co-chair for the Multicultural Subcommittee. But you know, if there is a skill that you have in terms of creating access, if you want to donate some PSA and ad campaign space where we can get multicultural, culturally inclusive messaging out about what does going from red to orange and orange to yellow mean? What can you specifically do to keep yourself safe? How can we keep our family safe? These numbers are directly affecting our Black, Latino, and Pacific Islander communities. And even within those communities, there are intersectional needs. How do we make sure that we also fund mutual aid groups that are helping our undocumented and immigrant families that won't qualify for the stimulus check? And I will also say that the governor appointed the Multicultural Subcommittee where I'm working with the two co-chairs, Byron Russell and Zeman Zhao, and they are exploring a partnership with the Community Foundation and other partners to establish an equity and inclusion fund. So if you're interested in donating, to being a donor, if you want to partner to increase, because that is going to address the gaps that we have now, but hopefully also establish a strategic plan that will allow us to close the inequities that we see. We're also hoping to drive policy, right? And in partnership with our state leaders, elevating the concerns that we're seeing that have been pre-existing, but that can really be addressed so that we change the outcome for generations to come. I can keep going, but I'm going to give some space to others.
So I will jump in and say everything she said, but especially want to emphasize donations to mutual aid, to aiding others. If you are a lawyer, pro bono assistance, particularly in the areas of migration and housing security, the mutual aid societies and donations of food, vitally important. I think even more simply, and ask just to be kind to that essential worker who you are engaging with, acknowledge and appreciate what they are doing and the risks that they are taking. And perhaps there are steps you can take to put people at less risk who are in circumstances that may not enjoy the same choices that you have. I think it's critically important to continue to appreciate where this problem has come from. It's deeper than disease. There are social determinants. We make up our society. We can make better choices. We can make changes. So that this is a sustained challenge. This will not be the first, or it hasn't been the first, and it won't be the last common challenge we have, but we have differentiated impacts. So we can take steps to minimize that. I encourage you to continue to educate yourself about these issues. We all can be lifelong learners, and we all can do something wherever it is we are, appreciating that all of these things are interdependent and interrelated. If we're indivisible in our commitment to creating change and stopping this pandemic, that'll require some work within to fully appreciate that we can't disregard who's dying. That'll only make the entire situation more dangerous for all of us. So not in the same boat, but in the same storm, and do what you can to be a little kinder, in addition to everything that Director Pena said.
Delegate Charles Newton, anything to add for the Navajo Nation?
Well, I think one of the pushes that we have been trying to be vocal on is the fact that this virus does not discriminate based on race, based on education, based on how much money you make, that it's, you know, we're all pretty much open game at this point. And we have made that clear to the Navajo people that, you know, that this virus can affect anyone and everyone, even those who are most vulnerable, but also those who are the healthiest. We have seen actors and actresses, people, you know, who are famous coming on and saying that that they do have COVID-19. We see how healthy they are. We see how fit they are, but that virus didn't stop because of how healthy they were. So I'd like to add to that and say that, you know, even though we are talking about minority populations and we're talking about the issues that we run into, I think that in the end, I would like to just state that we're all in this together. And I think that every community that gets any type of assistance is appreciative of those efforts. And on the Navajo Nation, I can certainly say that in our community of Shiprock, we have reached out to the Salt Lake City community. I've been in close contact with Moroni Benali, who is an activist there in Salt Lake City, who has been assisting with doing a food drive for the Shiprock community in the Northern Agency. So we are grateful for that. And I just want to say that, you know, these pushes to try to assist we do appreciate them. They are noted, and just know that our people are getting help from them. Thank you.
Thank you. And I would just add that, again, if anybody's interested in the drive that's being done for the 8 tribes of Utah, you can go to the Indian section's website on the Utah State Bar website, and there's more information there on how you contribute either actual items through the drive that they're doing, although the drive is ending today, or even if you can't participate in the drive for items, there's also a way to make monetary donations. And Director Pena, I believe I just cut you off. Apologies.
No, that's okay. It's just that I'm seeing a lot of the questions coming through. And so something that I wanted to also highlight, and thank you again so much for providing this platform, is that as we consider, you know, that this disease or the contagion is in no way discriminating, we do know that at the front line, we're seeing the greatest impact on those that do not have privilege to stay at home and work from home. So the essential workers, those that are in the factories, those that are having to make sure that we have food and access, the people working at the supermarkets. I love that Professor George mentioned, you know, let's make sure that we're being kind. Let's also for a moment acknowledge the privilege we have and the fact that we don't have higher risk of falling sick. And so what can we do for those that do run that risk and that have to compete with the idea of, do I go to work? Do I pay for food for my family? Do I go to work and risk getting sick? Or do I make sure that I can pay my rent because I'm afraid of being pushed out? Like, there's so many different questions that arise when income inequalities exist and when there is fear about whether or not services are accessible for you based on status. So I do just want to highlight the fact that this is a great opportunity for us to lean into this conversation of what does diversity, equity, and inclusion mean, and what does it mean for it to be a charge in my own life that I take up and that I become responsible for as it relates to any resource access I have, any privilege that I can use to be able to increase access to the most in need right now.
Great. So we have a couple of questions from Norma Gonzalez specific to the Latinx population here. She asked, why do you believe that the Hispanic population specifically has accounted for nearly 40% of the cases in Utah, while the Hispanic population only makes up 14% of the state's population? And she later asked, how can the community get the Hispanic group encouraged to be tested? So how can we encourage testing for Latinx populations?
Absolutely, that's a great question. Similar to what I had just mentioned right now, we recognize that a lot of our individuals within our Latino community are the essential workers in some of those high-risk community, in those high-risk jobs. And one thing I want to highlight is the fact that this is work that so many of our exceptional leaders are doing. Senator Luz Escamilla, in partnership with the Health Department and the University of Utah Wellness Bus, they are creating targeted events to go into diverse communities to make sure that they increase accessibility around testing. Our partner and one of our members of the subcommittee, Mikhail Moore in Intermountain Healthcare, they are doing efforts in other areas like Utah County, where we have seen an increase, Davis County, Weaver County. So we know that people are actively trying to change their practices versus just make sure everyone has access. Yes, but also let's make sure that we're following the data. Where are the hardest hit communities and how do we increase capacity in those spaces? So our subcommittee is also focusing on partnering with several individuals on those frontline efforts, but recognizing that that is just one answer. The other piece is messaging. Are our communities getting access to this in language accessible forms? So do we have the documents that are coming out in the multiple languages spoken in Utah? As I mentioned, Veteran Affairs, National Guard, and other partners are leading out in partnership with the Multicultural Committee. But also, is this information getting distributed through non-traditional channels, the WhatsApp that some of our refugee communities and undocumented communities might be using? Are we using local channels for Spanish radio, English radio, Navajo radio? How are we getting this beyond just downloaded on a website, but how is it targeted? How is it intentional? And I can keep going. Professor George, what are your thoughts?
Oh, you're on mute.
Unmute. And I was also trying to type an answer to a question from someone who asked about statistic for Asian Americans and Asians. And yes, that data is available. Check the American University Anti-Racist Research Policy Center. I was just looking for it, but I will just send that incomplete to whomever to ask the question. But the question posed was specific to the Latinx community in Utah. Again, there's an extent to which the answer is not a unique one. There's the disproportionate impact because there's pre-existing structural conditions that make social determinants of health inequitable. So there are the obvious barriers that Director Pena mentioned in communications and translation, but I think there are deeper structural systematic issues that we're going to have to continue to work to dismantle. So when I shared the data from the UK, that was trying to demonstrate that frankly, there is a universal challenge that humanity has to confront. It's a global pandemic, but in every nation, we will find the disfavored, discriminated against populations disproportionately impacted and to their detriment, right? So I didn't really go into the social determinants of health. I'll take a moment to just read out what those are. But this was the new approach taken over a decade ago by global health organizations and institutions, medical professionals, other policymakers. So rooted in experience and expertise and information and data. So your health is determined by your social conditions in significant part. Health outcomes, they found mortality, morbidity, life expectancy, healthcare expenditures, health status, all connected to social determinants of health. These include economic stability, that's your employment, your income, expenses, debt, medical bills, other financial support. After economic stability is the neighborhood and physical environment. What does your housing look like? Your transportation, your safety, access to outdoors and parks, playgrounds, can you play? Walkability, can you walk around without fear of being a victim of gun violence? There's some parts of some cities where that is not the case. Your zip code, literally your zip code, and I was responding to the question about Asian Americans or the Asian community in New York, they're tracking by zip codes. Your zip code determines how long you will live. What is it about those zip codes? These are the deeper questions we need to ask. Education, literacy, language. We know in the African American community, education and income doesn't correct still for the disparities. You'll die 3 years earlier than a comparable white person. Food, hunger, accessibility options, and then community and social context. This, if anything, is where our communities are advantaged in that social integration and network, but in an infectious pandemic disease situation, some of that is separating. Social systems, community engagement, a big one, discrimination and stress. The epigenetics of dealing with constant stress of being discriminated against, very detrimental to health. And after community and social context is healthcare system. So those are the indicators: healthcare system, community and social context, food, education, neighborhood, physical safety and environment, and economic stability. Those are issues that frankly, I think lawyers can be speaking to, legislators can be speaking to, our healthcare providers can understand better when people present to them. And frankly, every single one of us, and I'll turn it back to Director Pena to talk about the inclusion effort, I am absolutely convinced that every one of us, no matter where it is we are, can lead on these issues. So finding the sphere of influence that we do occupy, circulate your influence, and kindness would go a long way. How much less stress would there be? And how much less tension? That again impacts health. So it's interrelated, it's interconnected, it's indivisible, and we are too, and we've just failed to appreciate that.
All right, I think we have time for one more question. What is the best way to keep up with data on marginalized communities, especially in cases where data is not necessarily reliable because data on people of color communities, excuse me, is not tracked?
Dean Kronk, can I chime in on that question really quickly?
Yes, please do, Delegate Charles Newton.
Thank you. So there is discrimination and data reporting. Indian country has been underreported as far as the census goes, and a lot of the money that's portioned out to Indian country is based on population. Navajo Nation has been pushing that at the forefront at the federal level, reminding them of the underreporting that has occurred in the last census count 10 years ago. We are currently doing the census now, and so we're kind of curious as to see how much that number has changed. But in our community alone, in the statistics that have been provided to me with the data, I believe we were probably close to like 15 or 20,000 reported. So we did ask those questions. And again, a lot of the funding that comes from the federal government is based on population. So when they are underreporting, that affects the community as a whole. Every state does get funding based on population as well, so this issue doesn't necessarily impact Indian country as a whole. It affects the United States as a whole. And when we're talking about underserved populations, Indian country is a big part of that. And again, it does affect everything down to the medical care that we receive, the funding, the federal funding that comes down through the pipelines. How we address the issues that are currently on the Navajo or in Indian country, public safety being one of them. So I do agree that there is discrimination in data reporting, but the question that we keep coming back to is how do we ensure that the data that's being provided to the federal government is accurate and everyone is certainly being counted. Thank you.
Okay, well, I want to thank our panelists so much for your time today. I know I have learned a lot. You are clearly amazing people doing phenomenal work in your space. I think we could probably talk about this topic all day. I really appreciate those of you who were able to join us for today's presentation. Hopefully this has been helpful to you and has answered some of your questions. Perhaps there'll be another opportunity to continue this conversation. And I would be remiss if I didn't end in my personal capacity. I just want to take a moment to acknowledge the tribal land that we are on today. I am physically located in Salt Lake City, which is located in the Salt Lake Valley, which was a traditional meeting place for many tribes, where many tribes came together historically to meet and to celebrate each other's company. And so it seems very appropriate that today we should continue to meet, even if we are meeting digitally, to talk about these issues, how they're impacting our communities, and hopefully move forward with a greater understanding. And I know I certainly have been educated, and hopefully we can move forward and hope to address some of these challenges that have been discussed today. So thank you so much for your time, and we look forward to seeing you on our next webinar. Thank you so much. Goodbye.
Yeah.
Thank you, Dean.